A warm welcome to you all from the Department of Pediatrics, Yenepoya Medical College Hospital. So today's topic which we are discussing is one of the most important one when we consider children's health. So we all know that children do come to hospitals with the most common complaint, that is fever. And today we are going to discuss about it, and mainly it will help the parents, the teachers, especially when the child has fever in the school, and even some guardians, or sometimes it may help anybody, whoever has fever. Now the most important question the parents usually ask doctors, what is fever? Because when they touch the child, they always feel the child warm. What is fever? So what we as pediatricians say is they have to always check the temperature of the child using a proper thermometer. Nowadays in the digital era, we have a digital thermometer. You can just keep the thermometer in the axilla, wait for 2 minutes and you get the temperature reading. So if the temperature is more than 37.5 degree Celsius, that is fever. Sometimes the parents may not have a temperature which is giving a reading with the Celsius, or it can be a Fahrenheit thermometer. So in a Fahrenheit thermometer, if the temperature is more than 98.6, that is fever. But we all see that there is a diurnal variation, means morning time when the child wakes up, the temperature will be 0.5 degrees less. Evening time the temperature will be 0.5 degrees more. So it's normal. But whenever at any point of time you check the temperature more than 37.5, then it is fever. So next question they usually ask, why children get fever? It's a very common question. We all know that if the child is healthy, he should not get any fever. But only healthy children get fever because they are fighting with some or the other infection. So whenever a child gets infection, it will produce some cytokines. Cytokines are some amount of fighting agents in our blood which will fight against that particular bacteria, virus or any kind of infection, and that cytokine will cause increase in the elevation of prostaglandins, we say, which increase the set temperature, because now normally our temperature is set at 37.5, but this set temperature is increased to 38. It can go higher 38.5, it can go still higher 39, then it can still go 40, sometimes up to 41 degrees. So the set temperature is increased by the poisons or the toxins which are released in our blood by the bacteria or the virus. So what happens when the set temperature is increased? Our body responds. So do they feel that the fever is bad? No, it is good, because our body set temperature is increased mainly to decrease the multiplication of bacteria, to fight against those viruses and kill those viruses. So fever is required. So if a child develops fever, it is a good sign. But only thing is we should know what to do when we have fever. And most important question, the next question which they usually ask is, why this child is getting fever again and again, means very frequently. Because normally in a young child less than 5-year-old, we see that they get fever almost every month. It's common. If the baby is attending a daycare or a nursery, he will get mingled up with a lot of kids. In that case, the child will get infection from one or the other child and the child will develop fever. So viral infections are very common. So in the first 6 years, viral infections are the one which cause repeated episodes of fever. There are other infections which happen due to some bacteria. Sometimes the child may be eating some food, which the food may be contaminated, so the child can get fever. Nowadays you might have heard like infections like typhoid. We have leptospira. So these are all bacterial infections. So bacterial infections can also cause fever. And in this part of Karnataka, we have malaria. So it's a parasitic infection. Malaria is one which can cause significant fever. And when the rainy season starts, we usually get mites which are there in the farms and the grass. These mites can cause rickettsial type of fever. That's a different type of fever which responds to some other medication. So these are all viral, bacterial, parasitic and rickettsial. These are the more common fever which we get in children. But sometimes if the fever prolongs, like fever goes on for more than 5 days, 6 days, then we have to be cautious, and there we think in terms of other inflammation. Other inflammation like children usually get fever because of some other causes there. Okay, so there we have to go for detailed evaluation. So we have to keep in mind that we get fever from more commonly viral, we can get fever from bacterial and other parasitic infections. Now, is it a worry to get fever? What are the danger signs? This is a most common question asked by parents, and all parents should know what are the danger signs. Danger signs means when they should consider, yeah, my child is sick and I have to take the child to the doctor or take the child to the nearest hospital. So most important, the age of the child. Suppose the child is less than 3 months, don't neglect it. So don't neglect any fever in a child who is less than 3 months. You have to immediately take the child to the nearest doctor or the nearest hospital. And if the child having fever who is lethargic means more drowsy, sleeping more. So that child also has to be taken to the hospital immediately. So if there is any fever with the child having seizures especially focal, only one side the child has a seizure. So it's significant. So you have to take the child to the nearest hospital. Sometimes when we have fever, we may not find exactly focus of infection because most of the infections, it will either cause cough, cold, that means upper respiratory infection. It may either cause abdominal stomach pain and diarrhea, means a gastrointestinal infection. Sometimes we don't get any focus. When we do not get any focus of fever, that is again another sign where we have to take the child to the nearest hospital. Nowadays we have fever with rash, that is measles, very rampant. So if there is any fever with rash, there are n number of conditions which can cause fever with rash. So do not take a risk. Please take the child to the nearest hospital if the child has any rash with fever, because the child needs a proper evaluation by a pediatrician or a physician. Some children, whenever they have fever, they will have mild headache. That's normal, but when the child has very severe headache, intractable headache, there may be a chance that the child may be having infection in the brain. So you have to take those children who have fever with severe headache to the nearest hospital. Sometimes children may have fever and vomiting, but if the vomiting is persisting more than 2 times, 3 times, the child keeps on vomiting or the child has got loose motions along with fever, please take the child to the nearest hospital. Sometimes the fever continues for weeks together, and if fever is continuing for more than 3 weeks, and when the parents have investigated for more than 1 week, that is very important that the child should not be missed for any particular serious underlying condition. Please take the children who have fever more than 3 weeks to the nearest hospital and get a detailed evaluation. The hospital should be a tertiary care hospital like Yenepoya hospital. There you can take those children where a detailed set of investigations and evaluation is done, so that we don't miss any condition and the child is treated as early as possible. I think these things are clear. So when the parent or the school teacher should feel that it is something significant type of fever. One is fever less than 3 months old child, any child who has fever with lethargy, child who has a focal seizure, child where the fever focus is not found, any fever with rash, any fever with severe headache, any fever with persistent vomiting and diarrhea, any prolonged fever more than 3 weeks. So these are the conditions where it will give a red flag sign, so that the child has to be investigated immediately and taken care of as early as possible. Now when there is fever, mild fever or any fever, what should the parents do and what they should not do? That's very important. So first I will tell them what they have to do. So most important, any child who is having fever, please make the child comfortable. Make the child as comfortable as possible. The child will be more comfortable with the parent. It can be a grandparent or the mother of the child or the father. Whoever, please make the child comfortable with their parents. Second, give the child a dose of paracetamol. Paracetamol we routinely prescribe, and they can ask any of their nearest pediatrician about that, or else they usually read from the leaflet. So paracetamol is given for any child. So paracetamol decreases the fever. So you have to give the first dose of paracetamol. And as soon as that, don't rely that the fever will come down. You have to give good amount of hydration to the child. Hydration in the sense, you can either give water, or if the child is more thirsty, please give oral dehydration solutions like ORS. because that will prevent the child from getting tired due to fever and the child will be active. Okay, so this is very important, which we have to keep in mind, that if there is fever, not only paracetamol, you have to hydrate the child well by giving fluids. It can be any home available fluids like juice or water, or you can give ORS. Sometimes if the fever is very high, like more than 39, you can do tepid sponging. What is tepid sponging? You have to use a sponge or any soft cloth. Use the normal tap water. Neither use the hot water or the cold water. Use the normal tap water. Just dip the cloth, rub the child's skin and dry the skin. Rub it and dry it for at least 2-3 times. It will normally reduce the high fever. But don't forget, you have to give paracetamol and hydration along with this. Suppose if there is any fever in a child in the first 6 months to 6 years, some condition called febrile seizures are there in children. When they have fever, they get convulsions. So for them, doctors usually prescribe a medicine. We say that as frisium, but you should take the prescription from the concerned pediatrician where the child is shown, and that medicines can be continued. So these are the do's which you should remember. One is make the child comfortable, give paracetamol, hydrate the child well, and as much as possible if the fever is high, use tepid sponging. So these things you have to keep in mind, which you have to do when the child is having fever. Now next is what you should never do. Most important, please do not travel if the child has fever, because travel will again cause more discomfort for the child, and there are risks where the child can develop and spread the infection to others. So don't send the child to school, especially if the child has fever with rash. Please do not send the child to school. So never use very cold water, especially I have heard that some parents use ice water to reduce the fever. No, that is not the way. You should never use very cold water or ice water to do tepid sponging. Please use normal tap water, that is fair enough. And when the child has fever, they may feel cold. Sometimes parents put a lot of clothing on the child, 2 layers, 3 layers. Please do not do that, because when the child has fever, you give some medicine, the fever will not go out. Means the child is not able to get rid of the fever. The temperature will go higher and higher if you clothe the child more and more. So use light clothing on the child. Don't use tight clothing. Never use double layer, 3 layers on the child. Use only light cloth on the child. That's enough. Okay. Do not wait for more than 48 hours using home remedies at home. Maximum you can wait for fever where there are no red flag signs for 48 hours. But beyond 48 hours, please do not wait doing all home remedies, because there may be an underlying some significant thing which we need to investigate. And lastly, always remember, any baby who is less than 3 months having fever, don't neglect the child keeping in the house. So please take the child immediately to the nearest healthcare center or the hospital or the doctor and get him evaluated. So this is more important when the child's age is less than 3 months, because the risk of serious infections are more in a child who is less than 3 months. So finally, these are the key messages which I would like to give to the public. One is, fever is a very common symptom in children. We all know that. The cause of fever can be very simple to very complex. But it has to be evaluated. You should always know when to evaluate. So please understand the danger signs which I had told, the red flag signs which we say. So please try to note these red flag signs and see that you identify those red flag signs. If there are any of these, don't delay to take expert opinion and reach the nearest hospital or the doctor as early as possible. And lastly, remember, if there is fever, never forget to hydrate the child, giving proper home available fluids or ORS along with the paracetamol. So thank you. I think my talk has given you some insight on the fever in children, and I would appreciate if everybody follows this. Thank you, one and all.